I'm not implying that all endocrinologists are bad. There are some excellent ones. But I will say that if you have a thyroid issue, you will likely receive better care from another kind of physician. I realize this may sound controversial, but my experience indicates that thyroid patients do not receive the specialized care they believe they will when they visit an endocrinologist. And there are other kinds of doctors who are better informed and more likely to use the treatments that will improve your condition. Here's why the majority of endocrinologists will not order the appropriate thyroid lab tests. Your endocrinologist would probably order a test called a TSH with reflex to free T4, which measures your TSH and only orders the free T4 if there is an issue with it. This is the most likely scenario. While it is true that TSH is the most sensitive indicator of thyroid hormone on the pituitary gland, other thyroid lab tests can give thyroid patients a wealth of useful information. Some of the tests I'm referring to here are free T3, total T3, reverse T3, and thyroid antibodies. This presupposes that TSH is the best way to measure thyroid function and that the other thyroid lab tests are simply unnecessary. However, if you ask your endocrinologist to order these tests, they will probably laugh at you and tell you that they are simply unnecessary because they don't care about the results. For example, they won't change their decision to prescribe levothyroxine if you have abnormal thyroid antibodies. But what if you have low total T3? They will still prescribe levothyroxine with another side effect of levothyroxine. This is becoming a major issue because meta-analyses of numerous randomized controlled trials have revealed that more than 50% of thyroid patients clearly prefer combination thyroid medications, such as T4 and T3. But guess what? Without looking at these extra thyroid lab tests, you can't tell which thyroid patients would benefit from taking more medication than just levothyroxine. Moreover, you can expect your endocrinologist to order these tests, which would help you figure out what kind of thyroid medication you would respond best to. For this reason, they all treat the same way. Without having met your endocrinologist, I can tell with high certainty that he or she will likely simply check your TSH. However, I shouldn't say all because there are a few that don't fit into this group. And then modify your levothyroxine dosage according to that metric. It doesn't matter what kind of lab test she ordered, what the results of those tests indicate, or how bad you're feeling. From their point of view, their recommendation will always be the same. If your TSH is fine, you're fine, period. This kind of mindset is present almost everywhere among endocrinologists, as this is how they were taught. In fact, it's how all doctors, including primary care physicians and general practitioners. I know this because I was taught that this approach to using the TSH and prescribing levothyroxine is what we call the standard of care. When it comes to thyroid management, there is a wealth of data and research that supports the idea that doctors are failing thyroid patients. If you don't believe me, take a look at this survey of over 12,000 thyroid patients, which shows that on average, thyroid patients gave their doctor a failing grade of 5 out of 10, and they rated the need for new thyroid treatments as a 10 out of 10. Having a standard of care for any kind of disease is actually a good thing because it means that you can always expect the same treatment regardless of where you go or which doctor you see. If you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. The third reason is that endocrinologists lack specialized knowledge. I know it makes sense that someone who attends extra school to learn about a particular condition would have more knowledge about that condition than someone like a general practitioner, and it is true in many situations. Does this sound like a group of people who are happy about how they are managed or treated? No. And I can tell you from personal experience that thyroid patients who switch from levothyroxine to other alternatives often feel much better and have much higher satisfaction levels. The larger issue, however, is how endocrinologists view the condition. If your TSH is normal, then whatever other issues or symptoms you are experiencing must be caused by something other than your thyroid. This is precisely why you hear so many stories about patients complaining about thyroid-related symptoms like weight gain, hair loss, depression, fatigue, etc. Hypothyroidism is not uncommon or rare, but it is estimated that up to 12% of the U.S. population, or approximately 39 million people, suffer from it, only to be told that they are depressed, getting older, or needing to eat less. This is likely why surveys of thyroid patients reveal that these same patients have been complaining of the same symptoms for more than 10 years, and why so many thyroid patients end up taking antidepressants instead of having their thyroid medication changed. The truth is that many of these issues could be managed with the right information, but you are unlikely to receive that treatment from an endocrinologist because they are set in their ways. The fourth reason is that they may instinctively believe that consulting a specialist is a good idea. Because endocrinologists handle thyroid patients and problems on a daily basis, they tend to be less inclined to employ alternative treatment methods, which contradicts the perception that they are more receptive to new ideas, therapies, and research. I can't even begin to count the number of times thyroid patients have emailed me to inform me that their endocrinologist or doctor advised them against using X, Y, or Z treatments. Why in the world do these individuals follow advice from specialists who have never helped them feel better? Your endocrinologist is unlikely to learn about natural and effective treatment options like changing your diet, exercising regularly, and even getting more sleep, even though these things have a profound impact on how you feel. In my experience, doing these things can actually make you feel better than changing or tweaking your thyroid medication dose. This is because echo chambers continuing education conferences, where new treatments are supposed to be discussed, are frequently supported and funded by pharmaceutical companies who are motivated to push their own medications. However, when was the last time your endocrinologist asked you about any of these things? Or did they just check your TSH and then adjust your levothyroxine up or down? If you're like most thyroid patients, you'll get the latter rather than the former. Number 5 is that you won't be able to change your mind. This is a little different from number 4, but many thyroid patients get excited when they hear information like this, believing that if they take it to their doctor, they will be happy to receive it and probably change their current course of action. But once more, regrettably, this is the furthest thing from the truth. In treating a husband and wife, for instance, we had some incredible success. Together, they lost over 50 pounds, had more energy than they could ever have imagined, were able to stop taking several of their medications for conditions like high blood pressure and cholesterol, and were generally doing fantastic. They were obviously quite excited about this, so they told their primary care physician about me and what they were doing. However, rather than being happy for them and their success, he was more worried about me and angry with them for seeing me. No matter how happy they were or how successful they were, I discovered from this experience that most doctors are not very interested in trying new things or learning new things. In fact, they even feel threatened if other patients are responding better to someone else's treatment than they are. This isn't a universal phenomenon, but it does exist, and it's more common than you might think. The story's lesson is that, despite others' incredible success and outcomes, doctors frequently refuse to alter their practices or methods of treatment. All things considered, it's still worthwhile to visit your doctor and discuss this information with them to see if they're open to changing. However, don't be shocked if they show no interest at all. For the majority of thyroid patients, it's much better to get a second opinion rather than attempting to work with your current physician. When all is said and done, who should you see instead of an endocrinologist? This is precisely what I would do if I were just starting out. First, choose a nearby provider that accepts insurance. This will most likely be your primary care physician. Then, determine if they are receptive to new treatments. For the majority of people, your doctor will not be fully open to all of these options, but if they are willing to try natural remedies and order a more thorough thyroid lab test, they might be willing to work with you for a short while if you stick with them for 3 to 6 months to see if you can get better. If they aren't, simply find another doctor. These doctors are the most successful when it comes to choosing one. Physicians with expertise in anti-aging physicians with expertise in bioidentical hormone replacement treatment naturopaths or physicians who practice natural medicine, as well as physicians who specialize in integrative or functional medicine. The main drawback of visiting these doctors is that they are usually costly, don't usually accept insurance, and may not even be in your area depending on where you live. However, in my experience, the cost is frequently justified, particularly if it helps you eliminate persistent symptoms like fatigue, weight gain, depression, and other thyroid-related symptoms. I'll leave you with this idea. Nobody is more concerned about your life or your symptoms than you are, and you won't receive nearly the same degree of attention from someone else when you entrust them with your feelings. Even though some of this may sound depressing, there are a number of things you can start doing right now that have been shown to help other thyroid patients feel better. Some of these include simple things like eating more whole foods, exercising frequently, or getting more sleep, but you can also add supplements to whatever you're already doing. If you'd like to see a list of the supplements that I believe have helped the most thyroid patients feel better, I'd suggest watching this video next.